splash at this year's JP Morgan Healthcare Conference earlier this month. At the center of the healthcare transformation is global growth platform for entrepreneurs, Startup Health. Joining me right now is Startup Health co-founder and CEO Stephen Krein. Stephen, good to have you on the program.
Thanks for having me back, Maria.
Characterize where we are right now. You're seeing all this innovation with regard to the marriage of technology and healthcare. Where's the most activity?
Well, the most activity actually is around just entrepreneurs reimagining every aspect of healthcare, really thinking about everything from payer solutions, provider needs, and quite frankly, patient needs. So healthcare consumerism is driving a whole new generation of entrepreneurs across the world to really reimagine healthcare.
And Startup Health is hoping to be that gathering place, bringing all of these entrepreneurs together to ensure that you've got the entire network, whether it be payer solutions or monitoring centers type businesses.
Yeah, exactly. So we've been entrepreneurs for almost 20 years, and what we felt like was that entrepreneurs should no longer be alone. So what we've created is an entrepreneurship development company where we've created the first university for entrepreneurs transforming healthcare. We've organized the largest, most exclusive peer network of entrepreneurs transforming healthcare. We've really now had the largest portfolio of digital health companies around the world. And finally, we've organized a stakeholder network of all of the investors and customers and advisors for these entrepreneurs to really accelerate their innovation.
Tell me about quality versus quantity, because I think what's happening within healthcare and technology right now is a real consumerism of healthcare, right? You've got things like HealthSpot in, Rite Aids. You've got things like Theranos in Walgreens. Is the consumer sort of dominating this marriage of healthcare and tech?
I wouldn't call it dominating, instigating. I think instigating. We're seeing healthcare consumerism really play a role, healthcare reform play a role. The idea that we're now having a global conversation and that solutions are not just in Silicon Valley and New York. They're in Tel Aviv, in Dubai, in Austin, Texas. They're really coming out from everywhere. And it's actually who are the entrepreneurs? Doctors, clinicians, and people who never before had access to resources like the type of resources that Startup Health has been able to bring to market.
And that's where technology comes in, because there was a big incidence of, for example, skin disease in India. They couldn't, those people who were, needing to get treatment couldn't get to the doctors that they needed. So what happens, they could actually take pictures of what's going on their skin and then end up talking to the best doctors in the world.
Telemedicine's playing a big role. In fact, the company that we just brought into Startup Health is from Dubai and bringing telemedicine to all parts of the world. And we have companies here in the U.S. doing the same thing, where doctors are now able to, not only remotely visit people, but we're going to see the remote monitoring of patients explode and really hospitalization leave the hospital and go into the home.
Nobody wants to be in the hospital. They want to be cared for in their own home. The ultimate million or billion-dollar question becomes, does this pressure costs down? Will we actually get our arms around the high cost of healthcare? Does what you're doing actually impact costs?
Yeah, I think what we're doing, what the entrepreneurs are doing, what the large companies are doing, and quite frankly, what the government's doing. I think just yesterday, the Department of Health and Human Services announced that in the next 3 years, over 90% of the payments are going to be value-based versus fee-based. So you're going to actually see doctors and other organizations having to be accountable for the actual wellness of their patients.
Which is a positive for the whole Consumerism Act. It's basically telling you that the onus is on the individual to actually make sure to control costs.
Yeah, I think that's one of the most exciting things. Everybody plays a role in this transformation, not just the entrepreneurs, but investors. We're seeing corporate investors, venture capitalists, angel investors really support early-stage companies much earlier than companies had ever been supported before. We were just at the JP Morgan Healthcare Conference, and what traditionally was life science and biotech, much later-stage companies, was dominated by healthcare entrepreneurs. People came out in droves to see the innovations. We had 55 of our companies present to 500 investors at JP Morgan and really get to see this early stage innovation in action.
You're right. We were there too. So how do you grow the business at this point? What's the next level in terms of Startup Health?
Really keep supporting entrepreneurs. We feel like entrepreneurs are the key to the reimagination of healthcare. So in addition to our coaching program, in addition to our network, we launched the first syndicate to bring angel investing to digital health. And so we're actually focused on opening up the conversation and really engaging anybody that wants to help support the entrepreneurs or be an entrepreneur. So we're going to expand to build 1,000 companies globally as part of Startup Health, so the entrepreneurs can figure out what works, what doesn't work, and really just accelerate their innovation.
I love it. Come back and give us an update when you can.
Thanks for having me back.
Thank you so much. Stephen Krein joining us, Startup Health.